Good morning, ma'am.
Yeah, very good morning. Yeah. I extend a warm welcome to Dr. Munira and all the participants who have logged in. On behalf of Sri Devaraja's Medical College, University Center for Health Professions Education has been conducting webinars and workshops and conferences for the last 2.5 years since its inception. And we have had eminent educationists share their experience and empower educators, not only with respect to the domains of learning, but also with skills that are aligned with the recent regulatory bodies for all the programs. And one among them being reflective narration. There was a lot of concern among educators of all the programs regarding how to actually equip themselves with this particular, what can I call it, competence of writing reflections or assessing reflections or incorporating this reflective writing in the curriculum that is mandated by National Medical Council. So for this, we have requested Dr. Munira to be amongst us today and give her inputs and guide us in this process. I request Dr. Ashwini, Organizing Secretary of this event, to introduce Dr. Munira to the participants.
Good morning. Dr. Munira is a professor and associate director, GSMC FAIMER, and also co-convener GSMC KEM Medical Hospital and NMC Nodal Center. And she's affiliated to Seth, GSMC, and KEMH Hospital. So she is a medical educationist, mentor, peer reviewer, and a teacher and a researcher. And to her awards and achievements, she is a member of task force of MUHS to prepare blueprint of physiology subject for CBME curriculum 22-23 batch and BDS 24. And also she is a member of task force of CBME syllabus 2019 and also member of ECE expert group of NMC. Over to you, Dr. Munira, for this one session. Thank you.
Thank you, Dr. Vinita and Dr. Ashwini, for that warm welcome. And I'm glad to be here with all of you and hope for the next 45 minutes to 1 hour, we can have a nice, fruitful discussion. I'll be sharing things which I have learned over the period, and I will also like to learn from you all with your inputs. So with this, I'll just share my screen. Yeah, can Dr. Ashwini just let me know if my screen is visible and if my audio is good?
Yeah, you're visible and you're good. Good to go.
Okay. Okay. So this was the topic Dr. Vinuta approached me with, that is reflective writing. And why am I here sharing about reflection with you is that since the time in 2019 that this new curriculum came up with competencies which were ranging not only from the cognitive domain, but explicit competencies even from the attitudinal domain. Then we needed to have a documentation of the learning and achievement of the competencies. And we also had to record their achievements and assess them. And that's how this entire thing about reflections came into picture. And we have our students who have been asked to write reflections, and we are supposed to grade them. And now I think we have the continuous internal assessment where a lot of things are going to be marked and gradings are going to be offered. So with this, I would first like to thank Sri Devaraja's Academy of Higher Education and University Center of Health Professions Educators, and especially Dr. Vinuta for inviting me here today. I would also like to acknowledge 3 people from whom I have learned more about reflection while discussions, while working with them, while listening to their thoughts. That's one is Dr. Hinal Shah, who's Professor, Department of Psychiatry at Topiwala National Medical College. And Dr. Nirmala Rege, I think all of us are familiar with her. She is from the Department of Pharmacology, currently with Miraz University. Earlier, she was at say GSMC. And of course, because I needed my students to be reflective practitioners, that's how I ended up learning more about reflections. And the process is ongoing. So if I may ask you all to just, share a few words that come to your mind when you hear the word reflection. If you want, and if Dr. Vinuta doesn't mind, then if it's okay, you may also raise your hand. And if Dr. Vinuta can ask you all to call your names out and unmute and respond, will be very nice. So just one word which comes to your mind when you hear the term reflection. Thoughts. Thoughts about previous actions, introspection, perception, pondering, greater understanding, opinion, experience, thoughts, recalling action already done, expressing about what is learned, okay, so with these things in mind, I understand that there is some documentation about the learning which has occurred, about some experience that you have had, and it is some new learning. It is almost like rewinding or revisiting an experience that we have had. Thank you so much for sharing these thoughts. So if you look at literature, there are various definitions about what reflection actually is. And I'm using one which is provided in the AME guide, number 44, published in Medical Teacher. When I say reflection, it is something which is metacognitive process. You are thinking about your thoughts and about your experiences. This may occur before, during, or even after a situation has been experienced. The entire purpose of reflection is to develop a greater understanding of both yourself and also the situation. The purpose of this is that future encounters with a similar kind of situation, you are already ready and informed from your previous and past experiences. So a lot of terms come into the definition of reflection. Simply speaking, we can call it as a missing piece. It's a bridge between the external events that we are experiencing and the meaning that we make out of it. Dr. Vinuta earlier used the terms reflective narratives, reflection and narratives. So I just thought, because these terms are many a times used hand in hand or they go together, what is the similarity and what is the difference between narrative and a reflection? When I say narrative, it basically means the description of an event. It's like a story which is told by a person who is either observing or maybe a part of that event. But when I say reflection, it is more of the focus is on the person's response to that event, the personal changes which have occurred as a result of participating in that experience. So there is a slight difference. So many a times we write very good narratives, but they end up being just a narrative. You have to take it forward to have a portion of reflection also. Remember, reflection is a conscious activity where you are exploring your experiences, new understanding, you are exploring your thoughts as well as feelings. So I thought I would just go through today's session from 2 points of view. Since we have some learners in the audience and also educationists, I thought maybe from the point of view of learner, we should look at why they need to be reflective learners or reflective practitioners. Why are we asking them to write reflections? And how can they develop the skill of reflective writing? What do the teachers need? The teachers need the idea of how they can help and develop the skill of reflective writing in their students. how they can incorporate the reflective practice in their regular teaching, and of course, ultimately, with whatever is written, how do you assess the reflections? So taking the first section here, why should I be a reflective practitioner? So for this, we need to go to the Kolb's learning theories. Remember, we are all adult learners. We learn from experiences. We learn from the things that we observe. So when we talk of Kolb's learning style or learning cycle, it starts with the event which is being experienced, a concrete experience which a learner has undergone. After undergoing that experience or observing a particular thing, you may sit back, review or reflect on that experience, maybe draw some conclusions, make some meaning out of it, and then identify certain things that you need to learn, certain things that were missing, and then plan out or actively experiment what you have learned and what you will do in future if such a similar scenario occurs. Let's go into more details. So when I'm talking of reflection, of course, it follows the Kolb's learning cycle and experiential learning. But reflection helps us to learn. It transforms us by helping us identify our learning needs, making us more aware of our thoughts, our beliefs. It also helps us to develop professionally. Remember, whenever we are practicing with our patients, we have to continuously learn. We need to be informed and take decisions, clinical decisions which have to be taken very quickly. And reflection is one tool that helps us to prepare mental models. So in case you have a particular patient who has come to you, say a patient of COPD has come to you, chronic obstructive pulmonary disease, and you thought maybe a particular drug A will work best for this patient, and you went ahead, treated the patient, did the counseling, prescribed, and then when the patient returns to you, you find that what you expected or what you had thought would happen to the patient, that he would feel better, he would come back and maybe, thank you for making him feel better. That has not happened. Then you might sit back and you might reflect on why the results were not achieved. Maybe then you will go and think back, maybe this drug is not the best one for this patient, or maybe you will find that there are some other drugs which would work. And maybe you would also think about, what is the reason that you were not aware of these other newer form of treatments. And that's going to help you manage these patients, similar patients when they come to you next. When we talk about therapeutic relationship, here what we mean is the doctor-patient or a health practitioner and the patient relationship. So when we are talking of a relationship, it basically involves communication skills, it involves empathy, it involves professionalism. So similarly, a reflective practice will help you develop these relations and understand the nuances better so that you are in a better position to deal with your patients. So basically, where do you reflect? So reflection can occur anytime, anywhere. Remember, each and every one of us, because we are adults and have undergone a lot of experiences, these experiences have made some sense to us. We have some mental models and some personal theories that decide or relate to how we are going to behave in a particular scenario. But maybe when you are undergoing that kind of an experience, you yourself notice that something is not matching. There is some dilemma. Or maybe it's your peer or your senior, someone has given you feedback that something is not working or something needs to change. This disorienting dilemma or the feedback that you have received will trigger the process of reflection. And you might think back and reflect on that particular event, and maybe you will change some things, and maybe you will change your thoughts, your learning, and you will transform. So remember, there is some trigger to reflection. We may not intensely reflect on each and every experience that we have, but something which doesn't match our mental models, And there we go and start thinking about it. Whatever I have said, I think many of us are naturally people who reflect. We may not do so consciously, but even of a simple thing like we have a class, we have a presentation, we have a patient encounter, and we think about it sometime during the day as to things which went well, things which did not go well. And we also try to find out the reasons and inform our future actions about it. So the beauty of reflection is that we always learn in single loop. Say, for example, when you go into the community and you note that, okay, there are so many teenage girls who are anemic. So looking at that, you may want to devise some intervention to correct that thing which is incorrect or you think needs to be changed. So you may have a program which is giving them supplements, iron supplements, vitamin supplements, or you may have deworming medications to be given to all of them, or something which is going to correct that deficiency or anemia in that population. This is something which works like a single loop learning. So you found something which is, there is a lacunae and you have corrected that in a single loop learning. So this is the most common style of learning, which is just a problem solving approach. But when I talk of reflection, and if you're reflecting on this same situation, you might want to think about why this has happened. Why is it that the females are more anemic and not the male children of the teenage group? So maybe you may want to question about, why this is happening. Is there some other reason which is underlying? So it is more than fixing the problem. So you are questioning the underlying assumptions. Is it that people don't consider the nutrition of the females as more important? Are they not being given the fair share of nutrition? So you may find all these things, you may think about it, and you may yourself question your beliefs. And maybe the change that you may want to bring is education of the community, of the family members to change and correct the anemia. So we have single loop learning and we have double loop learning. Reflection carries out double loop learning, where you question your underlying assumption, values, beliefs behind what are the different practices and the way you behave. So different people have given a lot of theories about reflection. And this is one interesting model by Sean. He has worked intensively on reflection in his thesis he had on reflective practice. There's an entire book published by him. So what he says is, when we are reflecting, there are various time frames in which you reflect. So we reflect on our action after something's already happened, or you might reflect when you are doing that action. So many a times, when we're talking of reflection in action, this is what we need to do. When we are working with a case, you're working with a patient, you might need to reflect, think about it, and take decisions immediately. So reflection helps you create those mental models. Reflections may also inform your future practice. So before you're going to treat a patient or look into a patient or perform a surgery, you may reflect on the entire process, on your past experience, and you may decide what you will do for this particular scenario. So we have three different time frames in which you reflect. One is reflection in action, reflection on action, and reflection for action. It is something similar to what we do in assessment, assessment of learning, assessment for learning, and assessment as learning. Brookfield also gave one more aspect to reflections. That is, when we are reflecting, we don't only reflect on a particular event from our own perspective. We also have to step back a bit. Step back and look at that entire event as viewed by your other colleagues who were there during that experience, from the perspective of your learners, from the perspective of what literature says about this kind of an experience. So keep on changing your lenses to get a more better or holistic approach. So in this section, what I was trying to put forth and pitch to you all is that reflection is very important for learning, for therapeutic relationship, and even your professional development, which needs to continue lifelong. And you are going to reflect on your action, during your action, and inform your future action. When you're reflecting, look at it from perspectives of all people involved during that experience. So now, if reflection is so important, and we need to be reflective practitioners, how can you develop this skill of being a reflective practitioner? So there are two things here. So when we talk of reflective practitioner, I mean that you practice the art of reflection. You can do reflection in the form of written reflections, which is what we ask our students to do. But of course, there are various other ways in which you can reflect. So can I have some thoughts in your chat box? You can write down. A few of you may unmute and say, how can you help your students develop the skill of reflective writing? I'll take a pause here. I want to hear from you all. What you all do to help your students develop the skill of reflective writing.
Hello, Dr. Munira.
Yeah,
Jyoti here.
Yes, hello, ma'am.
I think since nobody is answering, I thought I'll share my view that if we want to encourage reflective thinking in the students and allow them to write reflections, then it can be incorporated very easily during the EdCom sessions, wherein especially after showing a role play or a video, so that it is easier for them to start developing these skills, because those scenarios would have touched their hearts in the affective domain. So it would be easier to start inculcating these ideas. That's what is my thinking about.
Thank you, Dr. Jyoti. So giving some scenarios or making them experience certain things which can trigger the reflections. I think people have mentioned.
Hello.
Yeah, yes.
Ma'am, we can divide the student into small groups, and we can ask the student to choose a problem, and among the group they can solve the problem, and in this way they can this is provide better understanding if they do.
Okay, I'll just give you my thoughts about it. So there are two things when we say reflection and we say problem solving or critical thinking. They are slightly different. Because when we talk of problem solving or critical thinking, the focus is on solving the problem. Whereas when we are talking of reflection, the focus is on self, on your learning, your understanding, your thoughts and beliefs, so that the reflective process is going to change you. So you can say these both things will supplement each other, because ultimately you want to solve a problem in the future. But remember, the focus is slightly different. If you have any, counter questions or comments on the statement that I have made, that's I'm very open to your sharing your thoughts. So orientation about skill, tell them about reflective writing, which is not a short note, very important, Dr. Yogi. Yes, giving scenarios, making them understand the topic. Yes, Dr.
Yeah, we can ask them to think about the positive outcome and a negative outcome of their whatever the target we have given.
Yeah. Okay. I think
hello, ma'am.
Yes, Dr. Rupa.
Yeah, good afternoon. This is Dr. Rupa from Dayanand Sagar University. So, in two small, those the STD, the small groups of 50 in two different batches. What we did is we just tried out combination of EdCom and reflective writing after the session. in the same session. So we gave like in the first group of 50 students, we divided them into three parts. One was given like a story written, which is an unpublished one, a local story, and the other by one of the authors. And then the other two were from the journal Intima, where, I think some of you know that here. So we gave like three different, two groups had winning stories, and the other one was a local story. And we gave them same questions and asked them to write on those 14 questions. So after the whole session was over, we made them do the reflective writing, like being inspired by that story, write on anything that is like, what has touched their heart on any topic. And then we made them read out.
Okay,
so that was for one session.
What I understand is you all use narratives, some narratives which are published and award-winning narratives for making the students reflect on it, giving them some structure or guided questions. And in the end, during the process, they learned more about reflections and they were asked to write reflections in the end. I think similar messages even come from Dr. Archana on the chat that provide some structure to teach them reflections, display newspaper clippings, ongoing events. Yes. So very relevant, showing them videos in AdCom session. So basically what we have to understand, it is a skill which is everybody doesn't have to the same extent, and we need to work on developing this skill. Now, when I talk of reflective writing, basically what I mean is an academic reflection. There are two categories of reflection. One is a personal reflection and one is an academic reflection. When I'm talking of personal reflection, I'm talking about sharing my deepest thoughts, my personal opinions, my beliefs, and maybe it may be something which is very private and I may not want to share it with the entire audience. So when I'm talking of academic reflection, can I ask Dr. Sunita to please mute yourself? Thank you. So when I'm talking of academic reflection, basically what I'm looking at is, it's a reflection which is expected to be presented for assessment in an academic, professional, or a skill development context. So what we are looking at is slightly different, which is academic reflection writing. So basically what we hope by asking the students to write the academic reflections is that they develop the perspective, they develop line of reasoning, they develop a link between the experience, practice, and existing knowledge. They show the understanding, appreciation of different perspectives. That is how you become more empathetic. Show recognition that your own understanding might be incomplete. Identify your learning need areas. Understand that everything is not black and white. There are a lot of gray areas in social life and in human relations and with your patients. The academic reflection should demonstrate learning from the reflection and how they hope to use the learning. And of course, in the academic reflection, they may quote or refer to theoretical literature to inform your understanding. I think while we have one person who has raised the hand, can that person unmute and speak, please? Okay, it's myself. Okay. Thank you. It was me who had raised the hand. Maybe the host has done some changes. Okay, so when we are talking of reflection writing and we want to develop these skills in our students, we need to provide some models and framework. Ideally, reflection should be free-flowing. It should not be curtailed by some questions or guidance which is given. But to begin with, or to start with students who are not very familiar with the process of reflection, a structure or a framework does help. Just sharing with you 3 frameworks. There are many frameworks. The simplest one which we are familiar with is the Driscoll model. Many of the universities are using this model because it seems simple for the students to follow. So it begins with the description of an event or an action, goes to explore, so what? explain why that action or event was significant, and then moves on to explaining how they will use that information to inform future practice. So what happened? So what? Now what? Or what next? This is a very simple Driscoll's model. My personal favorite is the reflective cycle or the Gibbs cycle, which I have used with students, and it helps them write the reflections in a more structured way. So it begins with description of what happened. So there are 6 steps basically. It begins with a description of what happened. Say like, say a resident, suppose it's a resident who has presented a journal club. And when we talk about that activity, maybe the resident will say, okay, I presented one article, journal club in my department. This was my first activity. And it went on for 15-20 minutes, but something happened. And I was not able to answer the question. I was particularly aware of different designs involved in research, and it made me feel very bad that I was not able to answer even the basic questions. I felt very anxious before the presentation. And since it was my first time, I was not sure what I should have been doing. I'm sure that everyone must have thought that I'm such an idiot that I do not know anything about research, even the basic things. So maybe this is the description of what happened, what that person was feeling, and what others probably were feeling. So maybe then we go on to evaluate the bad things about the experience and also something about which was good. So my guide told me that this happens with everyone when they're doing it for the first time. Then you go ahead and you make some sense about the situation. But okay, so now I have understood that when you are presenting a journey club in that article, you need to justify, find out what is the research question, see that if there are any other research designs which would have worked better, whether this is the best research design. What is it that I do not know? And then you will identify that, okay, I need to go back and read further about the research designs, and maybe that I could have done for the presentation. I could have discussed with my guide about the different ways in which I could have dealt with that topic, and the discussion would have brought out questions which may have made me better prepared to answer them during the large presentation. So next time when I'm going to do such presentation, I will ensure that I will read up all the relevant material and also have a discussion with my peers and my guide. So this is the entire process of a simple reflection that I have taken you all through, which can be done using this reflective cycle or Gibbs cycle as it is called. There are other models also. This is the 5R model, which I found in one journal of higher education. So it talks about how you need to report the issue, what was critical in that incident. So basically you're generating macro themes or ideas. Then you're responding to that critical incident. What are your observations? What were your opinions? What were the questions that have come to your mind because of being there? You may use relevant theory to explain why it is significant. Then how does it relate to yourself, professional practice, and to other similar incidents? Have you seen this kind of thing happening before? Were the conditions similar? Do you have the requisite knowledge and skills to deal with that particular situation? Then you may go on to reason as to use relevant theory to explain how and why the incident occurred or in the way it happened and why you behaved in a particular way. This is the time where you may introduce multiple perspectives of the people around you. And then in the end, you will reconstruct the entire model, hypothesize about the different possible responses, reframe future practice, and show new understanding. So these are models. You may use something to help your students become more reflective practitioners. Now, going to the next section again. So we know now that, okay, there are various ways in which I can help my students become more reflective and develop the art and skill of writing reflections. So how can I incorporate reflective practice in my teaching practice? Can I have a few responses in the chat box? So if you want to teach reflections, basically, what are the challenges that you face and how is it that you're going to overcome these challenges for introducing reflections in your teaching?
Ma'am, may I speak?
Yes, please.
Yeah, ma'am, I feel that reflections are basically difficult to understand for the educator himself or herself. So even if we understand it fully, like you just recently said that academic reflection is different from the reflection on a situation. So this is the integrate thing knowledge that we gain now. So we understand that reflection on your own teaching is different, and the critical thinking part is different. So when we are able to teach this to our students, and this is the first challenge that we face, and second one is the personality variations of the student. All student is different, they reflect differently. Some are introverted MBTI type personality who tend to be more reflective people, and some they don't bother, they don't understand what reflection is. So it is a challenge to make them probably understand and then write it in a language which is suitable. So that is, I think, a challenge.
So what I heard from you was that we ourselves are still learning about what reflection actually means. And we have to, in that process, we also have to explain the same thing to our students. And students have different personality types. Some are natural or more reflective practitioners and some are less. But remember, we all are. Any other thoughts? Any other challenges that you all are facing?
Ma'am, may I speak?
Yes, Dr. Anand.
Good morning, ma'am.
Good morning.
Ma'am, I feel one of the challenges is like there is a repetitiveness of reflections. Like because some students are like more vocal about what they feel and all. So and there are other students who just don't feel anything or just don't want to copy. So there is a gender. So that is one challenge, apart from being disinterested in the
Dr. Anu,
exercise.
we lost you for the last few seconds.
Hello, ma'am. Am I audible now?
Yes.
So, ma'am, repetitiveness, basically it is stemming from also from the lack of interest or disinterest of the students for this particular exercise. So I think they need more motivation to understand the real reason why they are being made to reflect.
So what I hear from you is that students don't perceive that reflection is helping them to learn, or there is
Yes,
any
ma'am.
benefit from reflection.
Yes, ma'am, absolutely.
Okay.
So
Okay.
yes.
I think
Thank
we
you.
have
Ma'am.
some responses in the chat also. Encourage brainstorming.
Ma'am.
Yes, please. Yes, Dr. Rupa.
Yeah, ma'am, one difficulty which I mean, I don't know how to mark them. Yeah. Like
Okay.
we did the experiment.
Okay.
That's one thing. Then secondly, it was more of a team discussion between between them. So that helped, they said, like when you put a Likert scale, that's one thing. But still, I don't know. Like when we talk of the 30 marks or whatever, that's one thing.
Yes.
Then one more thing is I've written the other one, what you said just now, but we have not experimented on that. That is the academic one. So I really don't know whether it fits properly into any of this different, whatever you're telling me. Like, I don't know if that is that. Yeah. So that's one thing.
Okay.
Language is another thing. I think that might be a barrier
Yes.
to understand.
Yes.
Language is
Absolutely.
high. Some students may not find it easy to
Absolutely.
understand.
Once I had a student who took my permission to write the reflection in the local language because she was more
Yes.
comfortable in expressing her thoughts on that. So these are all the challenges that we face. And yes, in the chat function, you'll have written about language. You'll have talked about the motivation of the students, and yes, and things that the reflection ends up being more of a narrative than a reflection. So let's look at what are the different ways in which we can overcome these challenges. So basically, the first thing that was mentioned by one of you was that we ourselves are learning about reflection and we need to teach the students about reflection. So the first thing is we need to teach the learners about reflection before we ask them to do. So use some simple models, use some structure. So help them describe what happened, do an analysis and sense making, and see how it will help them in the future to take effective next steps. There is one article called as 12 tips for teaching reflection. I'm just taking few of the tips which I feel which are relevant in the academic setting or in writing reflections. Okay, so when we write reflections, of course, we are asking them to write maybe in the class, maybe write at home. But the advantage of a written reflection is that there is a record. So when we want to record the achievement of competencies, this helps us in keeping a record. It shows us the progress longitudinally. On the other hand, when we are doing reflection in action, many times at that time, we're not going to be sitting and writing, we're going to be reflecting orally. Any other ways that you can think of which are more creative and which can be more interesting to students? Any ways apart from oral and written reflections?
Ma'am, two of the students asked for a storyboard writing, like two of them write one story with different characters. So that was one suggestion which came up.
Yes.
But then, yeah.
Dr. Sumita has also mentioned the form of drawing, blogs. Yes. Dr. Kiran, blogs. Yes. So there are so many different ways, and I think we limit the learnings by making them write reflections. So maybe we have to balance, get them interested by reflecting creatively, and maybe for certain essential elements, we ask them to reflect in writing. So that could make it interesting. I'm sharing one, just someone has already mentioned blog. So I thought I would just share that. So this is Dr. Anshu, who's a pathologist from Sevagram. Many of us may know her, educationists to know her. And I enjoy reading the blogs. And this is the first time when I read some articles, I felt that yes, there was a lot of reflection in them. So apart from the description of an event, she also explores her thoughts and the traditions and the beliefs which are going on. You could have, yes, audio recordings, blogs. Students are very good at blogs also, short videos, and of course the other storytelling formats. So when you're asking your student to reflect, as I told you, you can use prompts. So like from the Gibbs cycle, and I think one of you did mention that you give some 14 questions to the students. But remember, it's not a question and answer. So we have to use prompts very wisely, because in the end, it should not become like a question answer which is being written and submitted by the student. But yes, when you're doing group reflections and training them, many a times group reflections also help, like for ATCOM, if they have experienced the same event. But then maybe you could ask them to describe what happened, where it happened, when it happened, what were you doing, what were the other people, there who were, what do you think was happening, what was the result, and talk about the feelings from different perspectives during and after the situation, and evaluate the entire situation. What was good about it, what is it something that disoriented you, and how did other people contribute to this situation in the way it happened. Then you make an analysis of it. Did your actions match with your beliefs? You did something, but you did not believe that it should happen. You went ahead and helped the patient, but you never thought that maybe it's a communicable disease. You will have to, especially for the students from the first MBBS who are exposed to patients for the first time during their early clinical exposure sessions. So they have a mental model, like, if you go close to a person who's coughing, you may get cough, and then you have to go to that ward and you have to be near the patient. So there are certain beliefs that they will have to question and change. And of course, you will draw conclusions and identify your learning needs and the way in which you are going to learn. Basically, the reflection is also helping in making them more of self-directed learners. The entire process is incomplete if the teacher does not provide feedback on the reflective process and learning. That's our task, to train them to be reflective practitioners and also give them feedback on their learning. Now, feedback is different from assessment. Feedback is about what learning needs they have identified, what questions they have raised, and the entire process of writing the reflections. Whereas what we need to do is we also need to assess, and I'll be coming to that shortly. We need to create a mechanism to follow up on learners. Suppose they have said, I need to do this next time in this scenario, I will behave in this particular manner. So we need to hold the learners accountable for it. We need to ensure that their education is continuing. We need to help them set the goals, achieve the goals, identify the resources to achieve the goals, and even assess whether they have achieved the goals. So we help them, the reflective process helps them to make them more self-directed learners. And of course, lifelong learners, that is one of the roles envisaged by the National Medical Commission. Now comes to the challenge. I think Dr. Rupa mentioned, we are not very clear as to what we are doing with these written reflections. So what we need to identify is what is the purpose of reflection and what is it? Are you going to be grading it or are you going to give feedback to it? So are you going to be using the reflections for formative purpose or summative purpose? So with this, any thoughts from you on how you go about reflecting, assessing reflections? Again, a pause from my side. There are various ways. So I think everyone is doing in their own way something or the other in assessing the reflections. Even students are exposed to the assessment. They may agree to that structure. They may not agree. We are all learning and evolving in this. Logbook can be a good method. Toughest part is assessment. Dr. Saurabh has mentioned using pre-framed rubrics. Okay. Anyone is using any rubric for assessment of reflection and wants to share their experience? So Dr. Kiran feels it should be more for formative purpose. And I think maximally we are using reflections at our place for continuous internal assessment, demonstrating the learning. And maybe it is also a part, as mentioned by Dr. Sukanya, to enter into the portfolios. So reflection is a part of your learning portfolio and demonstrate learning. And this is what is needed in future for our students. So I'll just share my experience with assessing reflections. So there are simple ways in which we can assess the reflections and grade them. You could have, and this assessment, mind you, can be used for learning how to write also by the students. So it could start with just a description of an event. This has been given by Moon J.A. in his Handbook of Reflective and Experiential Learning. So maybe there are students who cannot even describe the entire event happening very well. But yes, it starts with learning how to describe the details of an event. And then you recognize that something is important. You go ahead to explain why it is important, how it affected your feelings, your attitudes, your beliefs. Go on ahead with judging about what went well or less well or why. And then describing the experience, how it has changed you, how it has transformed you, how you wish to inform your future actions about this. And even maybe you would include explanations and references from literature if it matches in that particular scenario. So this is one simple thing that we can just grade the students' reflection and give them a grading from A to F. And of course, as mentioned in the chat also, there are rubrics. There are many rubrics. I prefer this reflect rubric. So there's an article which describes how this rubric was created and what exactly are the components of the rubric. So basically, it describes the reflection. It grades it into 4 sections. One is the first 2 ones, habitual action and thoughtful action. These are non-reflective. Then moving on to reflection and critical reflection. How do you decide whether an assessment belongs to each of these criteria or which of these criteria? You look at the writing spectrum. Or how is the description? Whether there was a movement beyond just describing, whether there was exploration of the assumptions. Usually reflections are written in the first person or I. So what is the presence or the sense of the writer being present in that particular scenario? Is the conflict or disorienting dilemma described detailed and explored? Are the emotions related to this experience, have they been explored in details? Excuse me. What is the meaning which comes out of this entire scenario? And maybe you could add in some optional minor criteria as to whether the student has followed the instructions provided by the teacher for that particular task. So this is how you can identify whether the written assessment belongs to a reflective category or a critical reflection. And you have objective reasons that you are mentioning for categorizing them into these different categories. Now, so if you want to assess it more objectively, you're of course using the rubrics, which will give you definitive ideas as to and justification as to why you have mentioned whether it is a reflection or a critical reflection or non-reflective at all. So what do we do is first you read the entire narrative or the reflection which is given, then look at the details of the entire narrative, split it up, look at fragments, look at phrases which tell you what the student is thinking about. And of course, you again zoom out and then consider the entire outline of the narrative, look at the broader picture, and then defend the assignment level that you have assessed and the learning outcomes by mentioning what makes you say that the learner there is a presence of the learner or the person is exploring his assumptions. So you need to write out these examples. That completes your written reflection, assessment of written reflection. I know this is a lot to do. This is something which is going to take a lot of time. But during one of our workshops, we had a comparative study, you can say, which we did. We gave a sample reflection to few of the groups and made them assess it using that Moon's criteria, A to E. And for the other, we used the rubric. So it was found that there was more consensus with using a rubric. So I do advise that using a rubric would be good to objectively assess our students' reflections. So this brings me to the end of the discussion per se that I had planned. Open to your comments, suggestions, and questions for me to add something more or learn from you. Remember, we do not learn from experience, but we learn from reflecting on experience. Thank you so much. Dr. Vinuta, we are open to questions and discussion right now. Dr. Ashwini. So basically, if I summarize before I open it to questions, is we looked at what is the need or purpose of reflection and how it helps our learning. We also looked at how we can develop a reflective skill using various models. And we have seen about the challenges during using reflection in our teaching practice and some tips that we shared and discussed and how we can incorporate this in our practice and how to assess the reflections, which was a great challenge. Thank you so much.
Thank you, Dr. Munira. It was really, I think, a very useful session and very relevant. Like I can make out people have been calling me, like it has crossed 170 are watching on YouTube. And I'm very sorry. We used to have access for around 200 to join. I don't know what has happened this time. I'll have to go back into my IT and check. So if participants are, what shall we have? Discussion through chat, or can they unmute and talk?
They
You
can-
can raise your
Yes, they can just unmute and
hands
speak.
and we shall
Yes,
take your questions.
yes, please.
Can I, Vinuta?
Yeah.
Thank you, Munira. It was a great talk. A lot of learning and assessment on reflections. I am not sure how do we convince students about the importance and emphasis of reflective writing, because they are not very much convinced, or they are not motivated rather to get involved deeply into reflective writings.
Can I respond to this in a way that
Yes.
you always say that assessment drives learning? So I think the greatest drawback or lacunae on our part has been that we have asked them to write the assessment, but I am not sure that we are even reading for the odd 200 or 250 students when they come up with reflections on all the different activities, whether we spend time in reading and assessing them and giving feedback to them. So initially in 2019, we all were very highly energetic. We had the time and we had distributed students. So I had 10 students whose logbook I used to be assessing. And I actually read each and every page or word that they had written, gave them feedback, gave them comment, and even asked them to, rewrite or reflect with me on the spot. So it is this little extra thing that we need to make them realize that yes, we value what they are writing, we assess and read what they are writing, and we care about what they learn during this reflective process. If anyone else has any other way which we can make them more motivated, please do share.
Ma'am, don't you think that if we give a fixed questionnaire, like you shared me an article called it as 12 tips for teaching.
Yes.
So can we give them a fixed questionnaire in the logbook?
So I'll just share you in our university, that is Maharashtra University of Health Sciences, we use the Driscoll's model. We have given them these three broad questions, what happened, so what, and what next. Under these broad categories, they write their reflections. Now, as I mentioned, this is a basic model. And if you want to train your students to be really reflective, maybe we need to use the GIFT cycle and train them to write still further.
Okay.
We can use a structure, but remember the structure sometimes ends up being a question answer. I've found that out, and people sometimes who are really reflective practitioners, they feel bound by this structure. The structure is meant to be used if needed.
But most of the staff members, what I saw in the corrected logbooks and all, they won't follow a certain criteria. So it means that you have plenty of bias, plenty of the bias, while because of the shortage of the time, or might be the extra load what we have on us on our shoulders.
Yes.
So if we have some scale of measurement, as I told you, in the form of a fixed questionnaire, don't you think that it will be easy for all the people
Yes. So
to evaluate it?
So when we talk about, when you're talking about a fixed questionnaire, basically I understand that you are talking about some guidelines or criteria. So I think I just in the last couple of minutes, I did talk about a grading system as well as a rubric system. There are many other ways to assess reflection. If you search, we have to select what works best for us in our scenario. Looking at the time also, looking at the feasibility also. And I think in a particular medical college or in a university, if everyone is following a similar pattern, the students also know what to expect. Right now, the students also don't know what to expect. And that's where the bias and everything is coming into it.
Yeah, perfect. Thank you.
Thank you, sir.
Ma'am, I have a query.
Yes, Dr. Ram.
Ma'am, is there any number of reflections which the laid down by NMC, or up to how many reflections are adequate or desirable for a student during the MBBS curriculum?
It's a
Is there
very
any?
tricky tightrope that we have to walk, because I'll again share what we had done. So earlier we said, okay, all early clinical exposures, write reflections, all at form, you write reflections, because we
Okay, ma'am.
ourselves were not very clear as to otherwise how we will go about documenting the learning and this. So that was one of the challenges. And but now we need to understand that there is academic reflection writing fatigue in the students also. So maybe if we can put some set criteria or identify very critical elements that need to be reflected on. Say
Okay,
it is
ma'am.
the attitudinal domain or ATCOM module, what we say competencies, and not for just each and every small thing, like, you have self-directed learning also, they're writing reflections. Maybe then we can allow them or permit them to use some other formats of reflection if
Okay.
it is not going to be graded.
Ma'am, but is there a number? Can we put a number to it? No.
So there is no number as far as I know as to how
Okay,
many
ma'am.
reflections are there.
Okay. Okay.
Okay,
Okay,
come.
ma'am. Thank
You have
you.
asked, you come.
Someone has asked me, are there any online courses for this? Right now, I do not know. But at
Or you
my
want me to
institute,
come
we had conducted a course which was open to faculty as well as students. It was a 3 months course that we had done on 2 synchronous sessions per week, and a lot of asynchronous learning we had done.
Yeah, I'm sure the queries are endless because
Ma'am,
as
can you
and when
suggest
we are
some
doing
book? Can you can any author has published some books on this?
Yes, there are a lot of books on this, but many of the books are
You have a
from
PDF
19
format. Can you share it now? With the,
I have the AMI guide, which is a very good document. What I will do is I will share it with Dr. Vinuta and she can share it with you all, or I can just put it up in the chat.
yeah.
Just a minute. I'll just put it in the message, the LinkedIn group chat.
we can send it to the participants too if you have
Yeah,
if you
so
share with us, Munira.
yes,
Yes, ma'am. Yes.
do that. So what I'm sharing is the Reflect rubric, the AMI guide, and one example, how the Gibbs cycle and the triggering questions can be used by the students. So 3 articles I have shared. Maybe you can download them and keep.
Yeah, thank you.
There are many other handbooks available, but they talk more about the theory. Dr. Ajay has raised his hand.
Yeah, thank you, ma'am, for the talk. I just had a question regarding this. We take this session in the foundation course for the reflective writing, encouraging students to begin, because most of them, even we were never have done reflective writing. So it's a new thing as far as the theory is concerned, but practically, if I could get some, you could suggest some resource, we can get some samples of particularly medical reflective writing. That could be help some of the to start off. Yeah.
Okay, so one I have given you the Gibbs cycle, which I have.
Yeah.
And there is a sample reflection also, which I am sharing right now.
Okay, thank you.
So there are many available. Most of them are narratives, but few of them are reflection, and they may be of different levels because they are student reflections. So we need to identify and build upon it.
Good morning. Good afternoon, ma'am.
Good afternoon.
This is Dr. Shubha. I wanted to ask, we usually talk about the reflective writing in terms of students. why it is not a because PG curriculum, because that is where actually they'll be learning more, and that is where actually they'll go through each and every day. They'll have to know about. There is a task which is given for them. So why not it is made mandatory sort of in PG curriculum rather than UG?
Our PG curriculum, I think, are getting revised, and there is no document saying that you can't use reflection in postgraduate students. In fact, portfolios are a very good tool for postgraduate education. And if you see many students who are planning to go after their post-graduation, planning to move to different countries, they always create their learning portfolios. And in that portfolios, I think we can train them to reflect, write reflections, and even enter that in their learning portfolios. Sometimes we wait for mandates to come, but there is no mandate saying that we cannot do it. So I think we can take that step ourselves, one step ahead. And yes, it would be very ideal for a postgraduate learning.
Because they are going to be the next they are going to be the next generation will be implementing these complementary, the competency-based medical education. If they are actually trained in writing these reflection writing, as in giving feedback, because they are not trained in giving feedback and all that. So when they become the junior most faculty, I think if they are introduced to these concepts, they'll be better educators and facilitators of education. Facilitators of learning, I feel. That's my personal.
Yes, so very rightly said, and that is why we're trying to catch them young at an earlier stage in the undergraduate curriculum itself. I also thank you for all the appreciation in the chat box. Thank you so much.
Yeah. Thank you, Munira. And participants, if you have any burning questions or anything as you come by, you can leave a mail at the ID that you have, uchr.ac.in. Dr. Munira, can I forward those mails if there are issues that are...
Yes, please. And if Dr. Vinuta, you permit, can I also promote membership of Academy of Health Professions Education right now?
Definitely. It's a pleasure for us to be the platform where you can talk about it. Please do that, Munira.
Yeah. So just sharing with you all that we have an Academy of Health Professions Educators. This is a body which is a national body which is composed of health profession educators of all different fields. It was started by the brainchild, or you can say the idea of Dr. Rita Sood Madam, the late Rita Sood Madam, and Dr. Avinash Supe sir. Right now, Dr. Chetna Desai is the president, and I invite all of you to visit the website ahp.in and look at under the AHP, look at the objectives as well as the process for membership, and we hope that you will join us in this endeavor. Thank you so much. And of course, we under AHP we have a National Health Professions Education Conference, and this time it's at Lucknow, and Dr. Nirmala Rege and Dr. Suchita Dandekar are in the committee who are organizing this, and we hope to see all the interested participants out there and have more learnings. Thank you so much, Dr. Vinita, for giving me this opportunity.
Thank you, Dr. Munira. And I thank all the participants for their interaction and sharing of experiences. And I hope to collaborate in future on such fronts. Thank you, Dr. Munira. Thanks a lot.
Thank you so much, everyone.
Dr. Naveen to render the vote of thanks.
Good afternoon, all.
There's the feedback form which we have to fill. Can it be reposted?
Feedback forms are there in chat, ma'am. It's there in chat. You can fill the forms. You will get the certificates in 3 or 4 working days.
Can the feedback form be reposted here, please?
Reposting. Okay, wait a minute.
Yeah.
Yeah, after vote of thanks, I'll repost it now. Yeah. So good
Yes.
afternoon all. On behalf of Sri Devaraja's Academy of Higher Education Research, I extend my heartfelt gratitude to all who contributed to the success of this webinar on reflective writing. We are immensely grateful to Dr. Munira for sharing her expertise and insights with us. Thank you, ma'am. Special thanks to our distinguished officials of our academy for their support and guidance. We also appreciate the active participation of our esteemed participants who have joined through Zoom as well as watching through YouTube. Your presence and engagement have truly enriched the event. I extend sincere thanks to our UCHPE team and technical staffs for their support for ensuring a smooth and seamless experience. As we draw this session to a close, I want to express my gratitude once again to all. We look forward to future opportunities to collaborate and learn together. Until next time, take care and goodbye.
Thank you, everyone. Have a nice day.
Yes, ma'am.
We'll share I'll share the link again. You wanted me to repost, right? I will repost.
Yes.
it. Dr. Munira, thanks again.
Thank you, Munira ma'am. It was a wonderful session.
Let's say. 11.
Kindly share the feedback form, please.